Okay, after discussing about the cholinergic agents, now we'll discuss the drugs that act as an antagonist on the cholinergic system. Okay, there are basically two types. Okay, that act as an antagonist on the muscarinic system, and that act as an antagonist on the nicotinic system. Okay, first we'll discuss about the antimuscarinic agents. Okay, so these are the drugs that block the muscarinic receptor mediated actions of acetylcholine on heart, okay, on heart, on the central nervous system, in smooth muscles, and on the exocrine glands. Okay, now moving on to what are the actual drugs in this section. Okay, so basically atropine is the main drug. Okay, it is the prototype drug. Okay, and there is another one called iscopolamine. Okay, so these are natural forms, and from atropine various type of synthetic forms or its substitutes have been made. Okay, we'll discuss about atropine and iscopolamine later, but let me tell you some important point about these other drugs. Okay, about homatropine, cyclopentolate, and tropicamide. Okay, these drugs are basically used in ophthalmology. Okay. I'll only tell about certain points. Later, we will discuss about therapeutic uses of atropine and its substitute individually. Okay, these homatropine, cyclopentolate, and tropicamide are used in ophthalmology as an mydriatic agent. Okay, the next is ipratropium bromide and tiotropium bromide. Okay, these drugs are used in chronic obstructive pulmonary diseases and asthma. One major difference to note about ipratropium bromide versus atropine is that, okay, both atropine and ipratropium bromide, they cause bronchodilation. They both decrease the bronchial secretions. Okay, but the main difference on why ipratropium bromide is preferred is that this ipratropium bromide does not affect the mucociliary clearance, unlike atropine. Okay, if atropine will disturb the mucociliary clearance, then mucus plug might form, which will ultimately lead to problems. Okay, the blocked area may undergo atelectasis or it may give further sequelae. Okay, then comes pyrazine and telanzapine. These are mainly preferred in peptic ulcer. Okay, these are they are better drugs for peptic ulcer, but among the anticholinergic agents, pyrazine, telanzapine are also used in peptic ulcer. Okay, moving on to dicyclomine and oxybutynine. These are antispasmodic agents. Okay, and the oxybutynine, it is used in overactive bladder. Okay, then moving on to glycopyrrolate, we also know this to be the glycopyrrolate is also known to be given before anesthetic agents. Okay, as in pre-anesthetic agent, it helps it helps in decreasing the secretions. It is an anti-secretory agent mainly of the laryngeal area and also prevents the spasm of laryngeal area. Okay, thus helping in preventing airway hazards. Okay. Note one important point is that while atropine is in tertiary amine, that is, it can cross the central nervous system blood-brain barrier. This glycopyrrolate, it is not a tertiary amine, rather it is a quaternary amine ammonium compound. Therefore, it only has peripheral anticholinergic effect. Okay. The next is benzhexol and benztropine. Okay, yes, I think you will remember these as drugs used in Parkinsonism. These are centrally acting anticholinergics, means they can cross blood-brain barrier and help in Parkinsonism. Okay. Next, we'll discuss about atropine. Okay, its action. Then we'll discuss about the uses of this atropine and its substitute. Then adverse effect and contraindications. Okay, now atropine. Okay, it is a prototype drug among the antimuscarinic receptor block. Antimuscarinic agents. Okay, it is a tertiary amine, thus can enter CNS. Okay, this can enter CNS. That's why it can produce CNS side effects, okay, mainly when atropine toxicity occurs, okay. So what are the actions of atropine? These are basically, it is an easier way to remember the actions like this are uh, uh, anti-dumbbells. Okay, we already discussed about the mnemonic dumbbells, about when we studied the action of cholinergic drugs. Since atropine, it is an anticholinergic drug, and therefore it will have opposite the action, that is anti-dumbbells. Okay, D was for diarrhea. Atropine will cause constipation. Okay, constipation. How it causes constipation is that it will decrease the tone and motility of the gut, and it will increase the sphincter tone, thus causing constipation. U was for urination. So, what will atropine do? It will cause urinary retention. Again, similar. It relaxes the detrusor muscle but increases the sphincter tone. Thus, you cannot avoid causing urinary retention. Okay, this is especially seen in elderly men and those with enlarged prostate. Okay, M was for meiosis, that is constricted pupil. Now, what atropine does is it causes mydriasis. Okay, it dilates the pupil. Plus cycloplegia. Okay, cycloplegia. And for B was for bradycardia. Okay, B is for uh, bradycardia. Then what atropine will do? It will cause tachycardia. Okay, but remember that in the initial low dose, okay, it will cause initial bradycardia. Okay, this is due to blockade of the presynaptic AM1 autoreceptors on the vagal nerve endings. Okay, there are receptors called as autoreceptors on the presynaptic area of the vagal nerves, which when blocked will cause initial bradycardia, but later on it will cause tachycardia. Okay, the next B is for bronchial smooth muscles. Okay, what cholinergic agents do? They constrict the bronchial smooth muscles and they increase the secretion. But what atropine does? It relaxes the bronchial smooth muscles, it decreases the secretion, and as I already mentioned, it will decrease the mucociliary clearance. Okay, thus it may cause mucus plugs and further consequences. Okay, so we did uh, D, U, M, B, B. Now let's move on to L. L means lacrimation. What atropine will do is it will cause xerostomia or dry eyes. Okay. Okay, this is your beautiful eye. It is let me correct it. It is dilated by atropine. Okay, but it does not have any tear. Okay, it does not have any tear. It is a dry eye. E was for emesis. Emesis means vomiting. Atropine can suppress the vestibular disturbances that may lead to vomiting. Okay, the vestibular disturbances can lead to vomiting, and atropine will suppress this, thus causes decrease in vomiting. Okay, the second last one is dry mouth, again similar, and the last one is decreased sweating. Okay, decreased sweating. So this is anti-dumbbells, but remember that it does not affect milk and bile secretion. Okay, so this is anti-dumbbell. Okay, one of the another important action of atropine is on the central nervous system. Okay, it has anti-Parkinsonian effect by decreasing cholinergic activity in the basal ganglia. Okay, the its substitute like benzhexol and benztropine are used in Parkinsonism. Okay, and another CNS related side effect is atropine induced psychosis. It is mostly seen during the treatment of organophosphate poisoning or in cases of atropine uh, poisoning. Okay, if you give too much atropine, then it will cause atropine induced psychosis in case of organophosphate poisoning. Okay, and if someone consumes too much atropine, then they may have atropine-induced psychosis. Okay, next we'll discuss the uses of atropine and its substitutes. Okay, uh, now we'll see about atropine and its substitutes uses. Okay, what are the uses of atropine and its substitutes? Okay, first one is the ophthalmic uses. Okay, in ophthalmology, it is used as an mediatric agent and a cycloplegic agent. Okay, mainly for refraction testing, for fundoscopic examination. Okay, one more important point is that if you put atropine topically as an ophthalmologic agent, then it can produce your dilation of the pupil for 7 to 10 days. Okay, so newer agents were found, namely homatropine, cyclopentolate, and tropicamide. Okay, tropicamide is the shortest and the fastest acting one. Okay, uh, okay, so we did this. This is high, and I don't know if you recognize but I tried to draw a laryngoscope. Okay, it is atropine and its substitute, mainly glycopyrrolate, and atropine itself it used as a pre-anesthetic agent. Okay, they are used prior to the administration of general anesthesia to prevent vagal bradycardia and also to prevent laryngospasm by decreasing respiratory secretions. Okay, glycopyrrolate it is also used in sialorrhea. Okay, that usually occurs in heavy metal poisoning and Parkinsonism. Too much of excessive salivary secretions occurs, so glycopyrrolate can be used. The another one is COPD and bronchial asthma. Okay, mainly ipratropium bromide and diatopium bromide are used. They are usually given via metered dose inhaler. They are usually given MDI, metered dose inhaler. Okay, they produce bronchodilation without any affecting the mucociliary clearance. Thus, they are preferred over atropine. Okay, the next one is they are useful as antispasmodic. Okay, I tried to show spasm of the muscle in this figure. So they are used in dysmenorrhea, intestinal and renal colics. Okay, and mainly oxybutynin. They are used to relieve spasm after urological surgery. Okay, because they can act on bladder smooth muscle. Okay, and they are used in poisoning. Okay, atropine is a life-saving drug in case of organophosphorus poisoning. Okay, and it is also used in some types of mushroom poisoning. Okay, and atropine is also used in curare poisoning along with neostigmine. Okay, to counteract the muscarinic effect of neostigmine. And remember that this glycopyrrolate it is also used while waking the patient up after surgery. Okay, you give neostigmine as a reversal agent, but you also give glycopyrrolate. Why? Because neostigmine has muscarinic side effects and glycopyrrolate can counteract them. Okay, so we did this one. This is poison bottle. Okay, the next one is as an vagolytic agent. Atropine is used to treat sinus bradycardia and partial heart blocks that are due to increased vagal activity. Okay, its vagolytic property improves AV nodal conduction. Okay, so AV nodal conduction is improved. And lastly, it is used in Parkinsonism. The atropine-like substitute known as benzhexol or trihexyphenidyl benztropine, biperidine are preferred agent for prevention and treatment of drug-induced Parkinsonism. Okay, they control the tremor and rigidity of Parkinsonism. Next, we'll discuss about the adverse effect and contraindications. Okay. Okay. Now we'll discuss about the adverse effect of atropine and its substitute. Okay. It is very easy to remember. If you know the action on how atropine works, okay, if you basically remember anti-dumbbells, then it's very easy. Like on eye, it causes photophobia, blurring of vision, and it may cause headache due to blurring of vision. Okay, since since the pupil is dilated, you cannot see well, causing blurring of vision, and since your eye movement is paralyzed, cycloplegic effect. Okay, then you can have diplopia. Okay, and in eye it may also precipitate acute congestive glaucoma. Okay, therefore anticholinergics are not given in glaucoma patients. Okay, they are not given in glaucoma patients. Okay, moving on. On GIT, they cause dryness of mouth and throat, difficulty in swallowing, and constipation. Okay, on urinary bladder, they cause urinary retention, especially in elderly men with enlarged prostate. Okay, so they are contraindicated if the prostate is enlarged. Okay, if the prostate is enlarged, these are contraindicated. Okay, on CNS, on large doses, they produce restlessness, excitement, delirium, and hallucinations. It is also called atropine-induced psychosis. Okay, on the heart, they can cause tachycardia. Okay, increase heart rate. They can cause palpitations. They can cause hypotension, decrease BP. Okay, and if there occurs acute atropine poisoning or acute belladonna poisoning, then patient usually uh, presents with all sort of features, but there is a mnemonic for that, and it is very easy. Okay, we'll see the mnemonic in a while. Okay, so acute poisoning, acute atropine poisoning, or atropine OD, overdose. Okay, so the number one is blind as a bat. Blind as a bat. Since your pupil are dilated and you have cycloplegia, you cannot see well. Therefore, blind as a bat. Okay, red as a beet. Okay, beet is a turnip-like fruit or vegetable. Okay, I don't know exactly whether it is a fruit or vegetable, but it is red in color. Okay, so there is occurs cutaneous vasodilation. Therefore, you become red. Okay, red as a beet. The number three is dry as a bone. Dry as a bone, since they will interfere with secretions of many glands throughout the body. Your mouth will become dry, your eye will become dry. Okay, your throat will become dry. Therefore, dry as a bone. Number four is hot as a hair. Okay, number four is hot as a hair, and I think there is one another, mad as a hatter. Okay, mad as a hatter. There was a hatter that used to sell hats. Okay, and no one was buying his hats. Okay, and he got really mad and threw all his hats on the ground. So mad as a hatter. These are due to CNS side effects. Okay. Okay. Remember that severe belladonna poisoning or atropine poisoning can cause respiratory depression, cardiovascular collapse, convulsions, coma, and death. So, what do? The antidote is physostigmine. Okay, it is given intravenously slowly. Okay, let me write physostigmine. Okay, antidote. Okay, and it physostigmine is a tertiary amine. Okay, therefore it can enter central nervous system, thus counteracting both peripheral as well as central side effects of atropine poisoning. And why not neostigmine? Neostigmine cannot cross the blood-brain barrier, thus it does not act on the central effects of atropine. Therefore, we prefer physostigmine. Okay, what you do is you hospitalize the patient, you do gastric lavage in case the poison is ingested. Okay, if the patient becomes hot, okay, that since there is no sweating, the patient develops hyperpyrexia. Okay, sweating is a thermoregulatory mechanism. You do tepid sponging. If there occur seizures, you give diazepam, and the antidote is physostigmine. Okay. Next we'll discuss something about scopolamine. Okay. We'll now discuss about scopolamine. It is also known as hyoscine. Okay. It is another of the belladonna compounds. Okay. So, atropine is obtained from Atropa belladonna. It produces all the actions of atropine, but generally in therapeutic doses, it produces prominent CNS depression with sedation and amnesia. Okay, with sedation and amnesia. Okay, sedation and amnesia. Okay, so people may have short-term memory losses, problem of short-term memory losses. Okay, scopolamine has shorter duration of action than atropine. Okay, and it has more prominent action on the eye and secretory glands. Okay, the most important thing to know about scopolamine apart from CNS depression is that it blocks cholinergic activity on the vestibular system, thus suppressing the vestibular disturbances and uh, and therefore being used in, okay, sorry about that, therefore being used in motion sickness. Okay, it can be taken in oral form, or it can be applied as a transdermal patch. Okay, it is more effective for prevention of motion sickness. Okay, so if you give around 0.2 mg orally at least half an hour before the journey, then you will not get vomiting. Okay, and if you choose to apply the patch, please apply it at least 4 to 5 hours before the journey, and remember that its effect lasts about 72 hours. Okay, the side effects are like sedation and dryness of mouth. Okay, now we'll see about the drug interactions of anticholinergic agents. Okay, the H1 blockers, tricyclic antidepressants, and phenothiazines, they have atropine like effect. Okay, so they can potentiate anticholinergic side effects. Remember that atropine can decrease the bioavailability of levodopa by delaying the gastric emptying, and it can increase the absorption of tetracyclines and digoxins. Okay, let's see some of the drugs that have antimuscarinic effect or activity. Okay, the antihistaminics, tricyclic antidepressants, antipsychotics. Okay, amantadine, meperidine, quinidine, okay, are among these drugs that have antimuscarinic effect. Okay, let's see in brief about ganglion blockers. Okay, the ganglion blockers are hexamethonium and mecamylamine. Okay, these act on the NN receptor of autonomic ganglia on both the parasympathetic and the sympathetic ganglia. Okay, but they are rarely used, and no any sorry about that, but no any selective ganglion blockers have been made available till now. Okay, this is all about antimuscarinic agents and ganglion blockers. We'll discuss next about about adrenergic drugs. Okay, bye bye.